giving a presentation of our initiative in the 3 decades history of the ICDS project, where thousands of crores the government of India is investing in addressing the issues of IMR and MMR and RCH. Never in the history the information flown to from the field to the decision makers at the district level or the state level. So actually we have, using the available infrastructure, whatever infrastructure has been created by the government, using the same infrastructure, we have developed mobile applications, we have established a SMS gateway without any capex, without any capital expenditure, and also only operational expenditure is the cost of communication. Whatever we have done from our side, it is freely we are giving to the government of Andhra Pradesh. Now government of India has decided to scale it up to other countries. Just a few figures. 33% of the world's malnourished children live in India. Our condition is worse than even Africa also. Malnutrition limits growth and learning capabilities. 50% childhood deaths are due to malnutrition. 40% Indian children below 3 years are underweight. If you see even the tragedy which occurred in Bihar, the parents have sent their children not for education, for food. Those poor children who have died in Bihar. One of the major motivation is their children, they cannot feed their children, so they are sent to for. Only 15% of the mothers receive complete antenatal care. Only 58% receive iron and folate tablets in India. So always the traditional is they are sending by post or they travel the paper and in the diary or registers, and that is to come. And by the time, because if there is Anganwadis are the places where the community around 1,000 population, one center is there, and the children of 0 to 6 years old, and also mothers, lactating mothers, pregnant women, they come there. So there, whatever services they provide is preschool education, supplementary nutrition, referral services, and also health checkups, and medicine and folic acid distribution to the mothers, and also take-home ration for the 0 to 3 years children, and also to the pregnant mothers, and ready-to-cook food, and that. So these are the services they render in Anganwadi center typically. So we have developed a mobile application using an ordinary mobile phone, a low-cost phone. My target is hardly 1,000 rupees phone, because in the rural smartphones, etc., the population owns the smartphones. They're all in the urban areas, or they have also equally digitally empowered. Now to reach the last mile, see, mobile advantage is to reach the last mile. So those population, they have hardly, see, we have from the government side, for the first time in the country, 85,000 Anganwadis are given a free SIM. SIM has been given freely, and monthly rentals are also being paid by the government, and they have also been, motivation is they are using their own mobiles, and they are sending the performance. How many attendance of the children, attendance of the mothers, and whatever services rendered to the community. So motivation is they get around 1 hour talk time in a month, 60 to 70 minutes talk time they get freely to talk to their friends, etc. That's what is the motivation. So they have been sending the messages, around 30,000 to around 50,000 messages we are receiving per day, and lakhs of messages we have been receiving. And before that, actually we have, these are the services, and this we have launched in April, and nearly 1 year back, and before that we have developed another application for food supply chain management. That is, Anganwadis should be, because before monitoring the performance, we should also empower them so that there will not be any food gaps. So we have empowered the Anganwadis to indent the food and also whatever they require. That is also a mobile application. As a result, the food gaps in Andhra Pradesh have been eliminated. So this is, and now government of India has decided to scale up to around 14 lakh Anganwadis, to start with Madhya Pradesh, Uttar Pradesh, Gujarat, Tamil Nadu, and Meghalaya. 5 states we are taking up. After, subsequently, we will go to other states. So this is what is actually our effort, and this is what we have done. And what we are planning to do is, we are using right now SMS. Our objective is, when we are scaling up, right now we tied up with the BSNL. We want to have, because the operational expenditure should be low. So though the least cost the BSNL is charging, even that itself is a big amount. Around 20 lakhs, 30 lakhs is the monthly rentals which the government has to pay. So if telecom service providers, my request is to all the, even to Vodafone or anybody, if they can give a low cost solution for the Anganwadis and also for the ASHA workers in the country, because we are providing from Government of India side services to the Anganwadis as well as to the health and family welfare. A least cost, because at least a least cost service, so that minimum data about the services being delivered to the community we will be able to get. So thank you very much.
Thank you.